evening, everyone. Let me welcome all my viewers today once again on Beyond Sugar. It's always a pleasure to connect with you for these live programs and talk to you directly with the leading experts in our country. As you are aware, Beyond Sugar is created for all of you, for our viewers, not only to share with you information on a daily basis, which helps you be more aware about diabetes and its complications, but we also invite for you leading doctors from across the country who can talk to you as a friend and answer the questions which you have in mind. We keep on getting a lot of chats from you around some important topics, and one of the topic which we have picked up today is around diabetes and obesity, and is there a connection between that? And to talk on that, I'm very happy and glad to welcome Dr. Jasdeed Wazir from Gurgaon. Sir, welcome to the program. Welcome.
Thank you, Sanjeev.
Before I move forward and ask Dr. Jasdeed to set the ball rolling, let me formally introduce him as well to all of you. Currently, Dr. Wazir is director in Division of Diabetes and Endocrinology at Medanta Medicity in Gurgaon. He has trained himself in the medical from prestigious institutes like All India Institute of Medical Sciences and Maulana Azad Medical College at New Delhi. More than 2 decades of rich clinical experience and multiple research publications and awards he has to his credit. And he's also known to be a very patient-centric professional and healthcare professional. And the use of advanced diabetes technologies is one of his passion, and is always picking up the new things. He's also actively involved in a lot of patient education and community awareness through various programs on social media, or be it print media or even radio channels. And he is also a certified professional by World Obesity Federation to treat diabetes. So no better person than him to talk on this subject as well. Let me, sir, straight away call you in and hand it over to you for your opening remarks. That what's the relevance of today's topic and importance of it, and then we'll take in the questions from the audiences.
Thanks, Sanjeev, for the lovely introduction. But you missed one part of my introduction is my intense passion for prevention of diseases, including diabetes. So that's a part of my passion, and weight management, bariatric care, or obesity management is well aligned to prevention of diseases. So that would complete kind of my introduction to everybody who's tuned in. And let me congratulate you and your entire team, including the media partners, for putting such a great media effort towards disseminating awareness about common diseases, including diabetes and obesity. So, today is an extremely important discussion from the public health perspective. Now, the reason being, we hear day in and day out, not just in the media, the social media, the print media, but we come across so many friends, relations, and people we know being afflicted with diabetes. If we go to the formal numbers, as per the International Diabetes Federation, India is going to surpass most of the countries in the world to be capped as the diabetes capital of the world. That's really nothing to be proud of. So that's one part of it, the rising prevalence, incidence of diabetes, not just in the elderly or in people who are above the fifth decade. The most important relevant thing is about type 2 diabetes afflicting the young and productive population of the country. That, to me, as a healthcare giver, is the largest cry of the urgency of preventing diabetes. That's one part of it. Secondly, obesity and diabetes, as the topic goes, has a very crucial and an important bi-directional relationship. Now let's understand what I mean by bi-directional. Presence of obesity, excess weight, or excess fat predisposes an individual to the occurrence of diabetes, And in the next, throughout the discussion, whenever I use the word diabetes, I would be referring to type 2 diabetes. So, presence of obesity is one of the strongest risk factors for future development of type 2 diabetes. That's one part. The other direction is, in the presence of diabetes, if somebody has obesity or excess weight, by whichever definition we use, we'll talk more about that. It predisposes them to a greater risk of complications. So, obesity is not just causing or contributing to the occurrence of diabetes, but when coexisted with diabetes, what we call as diabesity, it significantly and independently increases the future risk of complications of diabetes. So, that would be the most simplified kind of relationship we need to understand about the coexistence of diabetes and obesity.
Thank you so very much, Dr. Wazir, for clarifying this and emphasizing this. And I think the point we should pick for all our viewers is that it's a bidirectional, it's a vicious cycle, one will lead to another. And therefore, it's very, very important to understand that there is a clear connection between the two, and both needs to be managed well. Let me begin, sir, by asking you, in our common ecosystem, we are still to define that how do we, say that this person is obese or I am obese. So is it done on the basis of weight? Is it done on the basis of body mass index? Or someone would say, calculate your waist circumference. So how do we actually define obesity in such conditions?
That's a very relevant, important question again from the public health awareness point of view. So I'll start with uh, which is the simplest way, and it may not really be scientifically proved. Whatever your height is in centimeters, let's say it's 176, you remove the 1, you get a number which is 76. So this is the roughest way of knowing what your ideal weight is. If your weight is clocking above that, so you're 176 centimeters, your ideal weight by this rule of thumb is 76, and you're weighing 85. So that means the weight is a issue here. The easiest way to define obesity, not really define, to understand there is a weight problem, then we go with weight. Weight independently should not be used as a marker for defining obesity or adiposity. The simplest, the most commonly used parameter to define obesity would be the body mass index. Now, how is the body mass index calculated? That's somebody's weight in kilograms divided by their height in meter squared. So it gives a numerical number which is expressed as a numerical value, kilogram per meter square. Now, when you achieve, when you calculated this number, how do we define obesity? Well, in the Indian context, number less than 23 is considered normal. 23 to 24.9 would be overweight, and above 25 kilogram per meter square would be defined as obesity. Let's take the next step above in diagnosis of obesity is by doing the waist circumference. Now, the waist circumference definition of abdominal obesity. We'll come to the relevance of abdominal obesity in disease or in type 2 diabetes later on. So, that in men more than 90 centimeters, or in women more than 80 centimeters, defines abdominal obesity, which as a pathological form of fat would be a more important determinant in predicting the occurrence of disease and or the occurrence of complications when present in a patient with diabetes. So now we are becoming more scientific in defining obesity. Then we see about the total body fat. Now, total body fat can be done by a body composition analyzer, which is usually available in a hospital setting or in for physicians who are providing weight management or bariatric care. A lot of these gyms and all also have body composition analyzers. Further going on, then we have technology like a DEXA scan, MRI, CT to define the total amount of fat. So, obesity or the impact of obesity comes through excess fat, not the kilogram weight. It is also, in scientific terms, defined as adiposity based chronic disease, which is ABCD. That's the correct scientific definition of obesity. Excess fat causing disease or complication. So that would be the very basics of starting from the very basics rule of thumb to the advanced diagnosis of obesity or excess adipose tissue or excess fat.
Yeah, I think so. For our viewers, you've got a full spectrum how you can actually understand that what is obesity or what can be defined as obesity. On one hand, he shared with us the simplest way that whatever is your height, just minus 100 out of it, and that should be your ideal weight. Although he moved on to then tell us more scientific ways of calculating this. Just in case you found this to be a little more mathematical, so there are applications available on smartphones which can help you calculate your BMI easily. But thank you for giving us this overview, Dr. Jasjit. So the next question, which I which people want to understand is, now if someone is having a higher weight or he is in the category of obesity, so what is the prevalence of diabetes in that? Is that everyone would go into diabetes, or more severe obesity will lead to diabetes, or can you share some guidance or thoughts on this?
So there is a linear relationship of weight and occurrence of diseases. But the important thing to understand, everybody who has obesity will not develop diabetes. That's very important to understand. However, the impact of obesity is not just limited to the increased chances of diabetes developing. So, the associations of obesity can easily be understood by the 4M impact of obesity. Excess fat in the body is potentially associated with 225 plus health risks or complications, which we divide into 4 M's. Very easy to remember. The first M being metabolic, like diabetes, blood pressure, cholesterol, fatty liver, PCOD. Second M would be mechanical, knee pain, back pain, acidity, snoring, something which we call as sleep apnea. These are common manifestations that everybody can relate to immediately. Third is the mental impact of excess weight, which is very important but rarely reported or discussed. As a part of my practice, I ensure this part also must be and should be addressed and assessed. So, mental would include self esteem, social, personal, professional performance, and how one feels about their own body. It's a very personal thing. The sum total of these 3 M's comes into the fourth M, which is monetary impact of dealing with all these complications and or with weight loss is the 4M associations of obesity. But not everybody will develop all of them. Some could have one, some could have two. That's the one way traffic when we don't address obesity. Now, once somebody understands this, or we as healthcare givers sensitize our patients about these, with weight loss, you're actually ensuring these many 225 plus health benefits to anybody and everybody who enters into a weight management program.
All right. So just adding on to this, there are also a lot of thoughts and myths that obesity runs in families. So it's hereditary. So if parents are obese, so therefore children would also be obese. So as a healthcare professional, can you help us understand that does it run in families or people pick it up? There are lifestyle issues or other habits which can lead to obesity. There are are there any other contributing factors?
So the last 10 minutes I've been talking very, very seriously. So let's lighten up the mood a little bit. You said, does obesity run in the family? There's a very famous cartoon about this. It's not just that it runs in the family. Obesity happens because nobody runs in the family. So that's one part of it. But what you said is I tell you by these many years of experience that, and backed by science, whenever I tell my patients this, most of them are wonderstruck with what data I shared with them. Obesity has a major genetic predisposition. Anywhere in between 30 to 60% of obesity can be explained by genetic predisposition. So that's one fact. Secondly, a large percentage of the genes which manifest as obesity are situated in the brain, in the central nervous system. That's again a very important, well proven scientific fact, seldom discussed. So, genetic background is an important predictor for obesity to manifest. So, think about this, that its genetics is like a loaded gun. You put a bullet in a gun, it does not harm you, but it's loaded. But the environment actually pulls the trigger of the gun, and that environment is nutrition, fitness, stress, and sleep. These are the four very important things. Uh, as a awareness drive should be shared, that these are the drivers, main most important drivers for obesity, and especially if the genetic background is there, it can happen more often.
Okay, so I think this is so wonderfully explained by him that yes, there can be a 30 to 60% chances, as you said, about genetics, but then there are a lot of controllable things which are there in your control. If you take care of them, then probably you may not have obesity kind of a situation. So moving forward now, if someone is overweight in our society or obese, first of all, people don't know or they want to know whether is it a medical condition. Does this require of them to meet a doctor if their weight is higher, or they need to take some measures which are self constrained measures and they need to apply those. What's your thoughts around this?
So see, Sanjeev, बहुत जरूरी चीज है कि it is not just how heavy one weighs, it is how heavy the impact of that excess weight is on their health. We talk about impact on health, the 225 uh, health complications or risks is exactly the core of why we manage diabetes. And yes, it is a medical condition which needs to be addressed lifelong. It's a fact, it needs to be addressed like we address cholesterol problems, like we address diabetes, like we address hypertension. Now think about this, obesity is kind of the fertile soil from where most of the non communicable diseases including diabetes, hypertension, cholesterol problems, PCOD, fatty liver, and numerous number of cancers emit. So rather than letting the disease happen, why don't we take care of obesity and prevent these diseases? It makes it much easier. Taking that example of diabetes. So, somebody who is at a higher risk of diabetes and is obese, It just requires them to lose 3 to 5% of their weight to prevent diabetes. But एक बार diabetes हो गई, it requires 15% or more weight loss to remit diabetes. Remit diabetes would mean दवाइयाँ बंद हो गई, sugar is normal. So that's the kind of thing. The earlier you start, the better the results, the lesser the efforts are required. So on forums like what we are discussing right now, prevention or starting early must be one of the most important key take home messages, that once you identify, be it by BMI, be it by waist circumference, be it by the rule of thumb, start acting right now, because here you're kind of providing a health insurance to yourself by some little efforts, which can go a long way in preventing so many diseases.
Okay. So I think what Dr. Jazir Wazir mentions here and emphasizes that start early. If you pick up that you are overweight or you have obesity, then take a medical advice. So, so when you say, sir, start early, can you further detail it, that what is that threshold when some, so there can be two situations. One is some person is having diabetes or hypertension, and along with that he's having high weight also. So his doctor will automatically then manage it as a course of treatment. But someone still doesn't have, let's say, hypertension or let's say diabetes, but there are signs in the age group of 25 to 30 that his weight is going over. So what is that threshold for such an individual to go and meet his doctor?
So see, you everybody needs to start getting aware. If the BMI crosses 23, that may be a very radical and over expressive statement, but I would justify that by, अगर हम ये करते हैं 23 से ज़्यादा पे सबको, we give them information about changing their lifestyles. It's a great thing. Even if you follow a small percentage of the advice and start at a BMI more than 23, you are more likely to be successful in preventing diseases than if you reach a BMI 30 and then start acting. So start early. I would use 23 as a cutoff point. Secondly, to further stratify the risk, somebody who's has a BMI more than 23 and has a strong family history of diabetes, blood pressure, cholesterol, heart disease, fatty liver, etc., should become that much more aware and aggressive at a lower BMI.
So I think this is very very clearly told by him to all of us, to all the viewers. अगर आपकी BMI 23 क्रॉस कर रही है, so that is the time you should go and meet your doctor and explain him your situation. And second, he mentions अगर BMI increase आपकी हो रही है 23 25 के आसपास है, it's not very high, but your risk factors are high, other family history and other things, then you must take the action right away and meet your doctor. So when the patient reaches you, then as a doctor, what are the approaches you apply? Then what are the different ways of reducing weight? The simplest things which people know is that okay, reduce your diet, do exercise, or then at the extremes you have the surgeries as well. So how does as a doctor you approach these patients and give them this remedial strategies?
So, the intricacies of managing obesity are out of the scope of today's session. However, uh, these are the five fingers or five interventions for weight management or obesity care, starting from nutrition to fitness. I don't use the word diet because diet sounds ki ye mat khao, wo mat khao, ye mat karo, wo mat karo. So I use the word nutrition. Provide the body with what it requires. Don't let excess happen. Don't let deficiencies happen. Second is fitness. Again, I don't use the word exercise. I use the word fitness because with fitness, you will guarantee longevity. Nutrition will help in weight loss. Fitness will help in increasing your longevity. So these two have to be combined. Third is drugs in those who qualify by the various medical criteria. Then comes stress management and proper sleep. These are the five cardinal pillars for medical management of excess weight. Then we further up the game in those who are at a very high risk or have multiple complications associated with obesity. There, bariatric surgery is a very valid option. And in centers who have trained psychologists, cognitive behavioral therapy is also a very important integral part of weight management. Now, in today's date, drugs for weight management have brought about a paradigm change in the way we treat obesity, in helping more people achieve more clinically significant weight loss. However, it may be associated with a lot of misuse. That's why it must be prescribed and monitored with only a qualified healthcare giver.
Okay. So yeah, right. So I think today, of course, we are not going in detail of how do we manage and reduce obesity, because that itself is a very wide topic to be discussed. But we'll more so, connect it with diabetes. So another thing, for our viewers, they want to understand that if someone reduces the weight or manages obesity, then does that also helps in managing the diabetes, reducing the blood sugar levels, or the onset of complications? Can it be conclusively said?
Brilliant question, and the answer is very very clear. Like I said, there is a linear relation. जितना weight बढ़ेगा उतनी chances of complications बढ़ेंगी. Tracing that same line down, जितना weight loss होएगा उतने ही फायदे मिलेंगे. The health benefits of weight reduction start at 3 to 5% weight loss, where 3 to 5% weight loss is associated with the reduction in the sugars, some reduction in the blood pressure, and some benefits in the cholesterol or triglycerides. जैसे ही weight loss बढ़ता जाता है, we start getting greater benefits on sugar control, greater benefits on blood pressure, greater benefits on lipids. Then, as it increases, benefits start appearing in fatty liver, PCOD, etc., etc. And once you cross the 15% cutoff point, there remission of diabetes can happen. Impact on mortality and morbidity starts appearing. So you can reduce the outcomes of obesity in loss of life and quality and improve quality of life with greater weight loss, and remission of diabetes requires at least 15% of weight loss. So 3% benefits start appearing, and as the weight loss keeps on increasing, the benefits keep on adding, and more organ protection is happening with greater weight loss.
Okay, so it's so very clear that as you work out on strategies to reduce your weight, manage your weight, then it will have clear benefits on not only the diabetes you're having, and but the various complications also which may arise out of it. So since we're also running out of time, so I'll just take one or two final questions. And the one is, although we can't go in details, but a lot of viewers want to understand about the nutrition part of it, because I'm sure it plays a very very important role in managing the weight. So are there any specific foods, particularly for a person who's having diabetes and high weight as well, which should clearly be avoided, or are there any things which you recommend that someone should shift their fooding habit or nutrition habits to?
So, again, one of the vital pillars for weight management or obesity care would be nutrition. And nutrition runs on three basic principles, and a fourth is the advanced principle. The basic principles are work on the quantity, quality, and timing of food. The other dimension of food is why we eat particular foods. That more is a cognitive behavioral intervention, which has shown very good results. But for very basic advice, it should be quantity, quality, and timing. So, the again, how does nutrition help in weight loss? It reduces the calorie intake, and calorie reduction would lead to weight loss. So that's the simplest mathematics, but the human body is amazingly beautiful. You keep on cutting calories, you will not keep on losing weight forever. The weight loss velocity will keep on reducing, it plateaus, and then it gradually increases. And that, while providing weight loss advice, is actually a challenge for the healthcare giver and the one who's seeking weight loss. So these three principles, and end of the day, we cannot compromise on what the body needs. The body needs carbohydrates, it needs fats, it needs proteins, it needs micronutrients, it needs fibers, all these things. We have to balance them out. So, an intuitive question which would come to people's mind is intermittent fasting, keto diets, this diet, all those diets basically create a very major negative calorie balance, and people suddenly lose a lot of weight. However, is it sustainable is the biggest question. Well, the answer I'll give it very upfront, it is not sustainable. So we rather work on the very basic principles of calorie reduction and maintaining good nutrition to ensure weight loss keeps on continuing. And when we are using five things, when I give this example to all my patients, कि हमें 100% result चाहिए, 100% result मतलब weight loss, and I'm giving you five things. So invest 20% in nutrition, 20% in fitness, and if suitable, 20% on drugs, 20% better sleep, 20% less stress. You gather 100%. So you don't put pressure in any one thing. You don't end up saying कि सब खाना छोड़ दो या दिन भर exercise करते रहो या 50,000 steps लो. You don't do that, because the journey for weight management must be comfortable, convenient, it should be durable, it should be safe and effective. These are the five parts of the weight management in clinical practice, which I would do for all my patients.
Yeah. No, thank you so very much. I think this is a wonderful way of explaining, and people should understand, especially all our viewers today, that not one thing may help you. And as Dr. Bazir said, a combination of all the things, balance of all the things, would probably help you. Before we leave, sir, one final question, and since prevention is also one of your passions, prevention of diabetes, and we these days see a lot of early onset of diabetes in younger population, and we also hear a lot about the childhood obesity, especially in the teenagers. So does this lead this childhood obesity, does this lead to early onset of type 2 diabetes without family history related risk factors? What's your guidance to the parents in this case, that what how this situation should be managed?
So this question goes extremely deep into raising a question: when should we start indulging in prevention of diseases? The prevention of disease, or let's say, let's just talk about diabetes, must start when a lady is pregnant, starting right there and then, to childbirth, to raising the child, to infancy, to childhood, and then adolescence. It You start as early as possible, because the roots of these things also lie in the perinatal period. So the ideal case scenario is start prevention right there and then. But the earliest you start observing unexplained weight gain or a excessive weight gain, which, as we were discussing earlier before we started the session, is most of the perceptions of obesity start by looking, or somebody looking obese, right? So whenever we observe a child gaining excess amounts of weight, that's one point of starting the preventive uh, stream, so that you don't let it progress, and taking care of the problem right there and then, sensitizing the family, the parents, automatically goes on to the child. And a very interesting thing, you take care of one person in the family, you provide them pediatric care, the whole family changes. That's such a wonderful thing. But starting as early as possible is is my bet on the best prevention of diabetes.
Hmm. Yeah. So I think some of the things which Dr. Wazir has emphasized today, we must remember those. And there is a strong connection, of course, between obesity and diabetes. It's important to pick it up early and also seek medical attention to it. I must thank here Dr. Wazir to you to join us today and talk about these things at such a vast length. Some of the questions we asked you were very, very basic, and I must thank you for your patience to answer them as per the in a very, very simplified way for our viewers. I must thank all our viewers as well who watched us live today or who may be watching this program later on. But before I really conclude and say good night to everyone, I'll, for the final words, again hand it back to Dr. Wazir sir if you still want to emphasize anything or summarize today's program.
So I would Sanjeev, first like to thank you and all the viewers for joining in, and you and your team for arranging this very important session where I could really talk my heart out in maybe adding a drop of preventive thoughts for everybody who's joined in. And the take home message is start as early as possible. The simplest way is that if somebody has a family history of any non-communicable diseases like diabetes, hypertension, heart disease, cholesterol, etc., and they are gaining excess amount of weight, calculate your rule of thumb ideal weight, calculate your BMI, start as early as possible, because starting early will be the easiest way to prevent diseases. Because once a disease happens, it takes that much amount of greater efforts in all fields to remit that disease or manage that disease. So the take home thing: start early, be very aggressive, and be persistent, and seek medical help if you're really at a high risk, as we discussed, because then the doctors, the teams who take care of weight management can guide you in the most optimal way in not just losing weight but maintaining your weight for a long, healthy, and happy life without any complications, including diabetes. And I thank all of you for joining in.
Thank you, Dr. Wazir. Thank you so very much. So, for all our viewers, if you have anyone in your family or friend circle who is having a little higher weight, predisposed risk factors of diabetes, you can always share the link of this program with them, and this conversation can be very, very useful for those individuals as well. If you want to revisit what Dr. Wazir said, this program will stay here. You can simply rewind, listen it again as many times as you want, to get the message right and clear with everyone. If you live in Delhi, NCR, or anywhere in North India, you can always visit Dr. Jazid Wazir if you need more information on this subject and seek help. If you are listening to us anywhere else in the country or other cities, please do connect with your nearest doctor if you have symptoms or the things about obesity which Dr. Wazir shared with us. Good night, everyone. Thank you very much, Dr. Wazir. Good night.